at ASCO 2016, there's been a lot of data that's come out about liquid biopsies, many presentations, and I was involved in one that we looked at actually specifically to EGFR. So this was from the big clinical trial TIGER-X with ruxolitinib, and ruxolitinib is one of the third generation EGFR TKIs. It's no longer in development, unfortunately, but what was great about this study for this presentation was that we had matched samples from tissue, plasma, and urine from a large number of patients. So we had tissue specimens from 540, we had matched plasma specimens from almost 500 of those patients, and then urine samples from just over 200 of the patients. And so what we were able to do is look at EGFR mutations, both activating as well as the T790M resistance mutation across platforms in those different specimens. So this is a really important data set for that analysis. Now, patients had to have T790M in order to go on the expansion phase of the study. So most patients were tissue positive for T790M, but we had allowed patients who had a local test that was positive to enroll. And during the dose escalation, there were some patients who had gone on where we didn't actually have known T790M positivity. So we had some that were negative. So what we then did was we looked in the tissue with a standard PCR-based assay. We looked in the plasma with the beaming technology, which is a PCR plus flow cytometry. And then in the urine, there's a test that's it's basically a next-gen sequencing assay that's been developed. It's called the Trovera test. And so in what we were able to show was that the concordance was very high. And so if we use tissue positivity as the gold standard, because that's kind of the standard, and compared it to sensitivity for both the plasma assay and the urine assay, in both cases it was just around 80%, so pretty high. But what was really interesting was to see that you could look for the T790M, and if you didn't find it in tissue, you actually could find it in plasma and or urine in a subset of the patients. So in total, about 60% of the cases where we had matched tissue, plasma, and urine all together, about 60% of that time there was true concordance where all three were positive. And then there was a small number where all three were negative, but very small. So for most of them, otherwise, there was at least 2 of the tests that were positive, and only a handful where only 1 of the tests was positive.